Diabetes versus keto diet. Does keto work if you have diabetes? Research suggests that people with type 2 diabetes can slim down and lower their blood sugar levels with the keto diet. In one study, people with type 2 lost weight, needed less medication, and lowered their A1C when they followed the keto diet for a year. Please, if you are watching this video for the first time, kindly like this video and hit the subscribe button and click on the bell icon, so that anytime I drop a video like this, you will be notified. Thank you. If you're insulin resistant, which means you have higher blood sugar levels because your body isn't responding properly to the hormone insulin, you could benefit from nutritional ketosis, because your body will need and make less insulin. Ketogenic diets are very effective at achieving two common aims of diabetes control: lowering blood glucose levels and reducing weight. What is a ketogenic keto diet? In essence, it is a diet that causes the body to release ketones into the bloodstream. Most cells prefer to use blood sugar, which comes from carbohydrates, as the body's main source of energy. In the absence of circulating blood sugar from food, we start breaking down stored fat into molecules called ketone bodies. The process is called ketosis. Once you reach ketosis, most cells will use ketone bodies to generate energy until we start eating carbohydrates again. The shift, from using circulating glucose to breaking down stored fat as a source of energy, usually happens over 2 to 4 days of eating fewer than 20 to 50 grams of carbohydrates per day. Keep in mind that this is a highly individualized process, and some people need a more restricted diet to start producing enough ketones. Because it lacks carbohydrates, a ketogenic diet is rich in proteins and fats. It typically includes plenty of meats, eggs, processed meats, sausages, cheeses, fish, nuts, butter, oils, seeds, and fibrous vegetables. Because it is so restrictive, it is really hard to follow over the long run. Carbohydrates normally account for at least 50% of the typical American diet. One of the main criticisms of this diet is that many people tend to eat too much protein and poor quality fats from processed foods, with very few fruits and vegetables. Weight loss is the primary reason my patients use the ketogenic diet. Previous research shows good evidence of a faster weight loss when patients go on a ketogenic or very low carbohydrate diet compared to participants on a more traditional low-fat diet, or even a Mediterranean diet. However, that difference in weight loss seems to disappear over time. A ketogenic diet has been shown to improve blood sugar control for patients with type 2 diabetes. The diet helps to lower the body's demand for insulin, which has benefits for people with type 1 and type 2 diabetes. If you have any question about diabetes, leave it in the comment sections. Thank you. How a ketogenic diet works. On a ketogenic diet, blood glucose levels are kept at a low but healthy level, which encourages the body to break down fat into a fuel source known as ketones. The process of breaking down or burning body fat is known as ketosis. People on insulin will typically require smaller doses of insulin, which leads to less risk of large dosing errors. The diet helps burn body fat and therefore has particular advantages for those looking to lose weight, including people with pre-diabetes or those otherwise at risk of type 2 diabetes. How to follow a ketogenic diet. Based on the understanding that carbohydrate is the macronutrient that raises blood glucose the most, the primary goal of a ketogenic diet is to keep consumption lower than that of a traditional low-carbohydrate diet with moderate protein and a very high fat content. This will determine the nutrient density of the ketogenic diet as well as how to follow it, as different foods will have different effects on insulin and blood sugar levels. Which foods to eat on a ketogenic diet? There are a number of different types of ketogenic diet with variations in the level of carbohydrates and protein allowed in the diet and/or the amount of time someone is looking to spend in ketosis. Benefits of a ketogenic diet. Ketone bodies produced from burning fat for fuel have been shown to have potent weight loss effects, help lower blood glucose levels and reduce people's reliance on diabetes medication. The diet has also shown evidence of having benefits on reducing high blood pressure, reducing triglyceride levels, raising HDL cholesterol levels, a good sign of heart health, improving mental performance. In addition to that, there has been a lot of interest in therapeutic ketosis for other long-term conditions, such as cancer, epilepsy, Alzheimer's disease or dementia. How can a keto diet help other conditions? Do I need to measure ketones? Significant weight loss and blood glucose control benefits can be derived from even a mild state of ketosis. There are a few methods you can use to measure the levels of ketones in your blood, urine or breath, each having their pros and cons. For more information about ketogenic diets, I left a link below to guide you. Thank you for watching my video and see you in my next video.